Hey, welcome back. In this video we will talk about the risk factors of cervical cancer and how to prevent cervical cancer. In the previous video, we talked about the symptoms of cervical cancer. If you have not seen that, go and see it. The link is in the description. So let's start with the risk factors. Number 1 is human papillomavirus, the most important cause and leads to 90% of cases of cervical cancer. HPV types 16 and 18 are the cause of 75% of cervical cancer cases globally. Women who have sex with men who have many other sexual partners or women who have many sexual partners have a greater risk. HPV infection causes cells to change. If not treated, these cells can become cancer cells. Once high-risk HPV infects cells, it interferes with how these cells communicate with one another, causing infected cells to multiply in an uncontrolled manner. Number 2. Smoking. Smoking raises the risk of cervical cancer in two ways. 1. It may cause DNA damage that increases the likelihood of cancerous changes to cells. 2. It may weaken the local immune response of the body and reduce the ability of the immune system to clear HPV from the body. Number 3. Marriage or sex at an early age. At an early age, women caught HPV, a sexually transmitted infection, STIs, that in susceptible women is responsible for virtually all cases of invasive cervical cancer, ICC. Number 4. Multiple sexual partners. Having intercourse with many partners can increase exposure to HPV, which is transmitted by sexual contact. Number 5. Poor genital hygiene. Poor hygiene increases the risk of getting the infection. No. 6.is The long-term use of oral contraceptives. You might have heard that excess of everything is bad, so here is the case. Women who have used oral contraceptives for 5 or more years have a higher risk of cervical cancer than women who have never used oral contraceptives. Number 7. Weakened immune system. Leads to increased susceptibility to HPV and cervical cancer. Number 8. Family history. You have an increased risk of cervical cancer if your mother, sister or daughter has had cervical cancer. We don't know whether this is linked to faulty genes, or whether it is due to common shared factors like smoking. Stop here and mark the list and find out yourself whether you are at risk of developing cervical cancer or not. Hope you have found it. Now we will talk about what are the preventive methods of cervical cancer. Cervical cancer can often be prevented by following methods. Number 1. By having regular screening with Pap Smear or the Pap test. Pap test. The Pap test has been the most common test for early changes in cells that can lead to cervical cancer. This test is also called a Pap smear. A Pap test involves gathering a sample of cells from the cervix. Number 2. By HPV screening test. This test is done on a sample of cells removed from the cervix. This sample is tested for the strains of HPV most commonly linked to cervical cancer. HPV testing may be done by itself or combined with a Pap test. HPV test and Pap smear test can be done alone or can be combined with one another. Number 3. HPV vaccination. To help prevent cervical cancer, HPV vaccination is recommended for all adolescents as part of their routine vaccines. It may be given starting at age 9. Talk with your healthcare provider about the appropriate schedule for vaccination, as it may vary based on many factors, including age, gender, and vaccine availability. Number 4. Avoid promiscuous sexual activity or the safe sex. Number 5. Use condoms or other contraceptives during sex. Number 5. Quit smoking. Number 6. Maintain proper and better genital hygiene. So, you should get your screening done and get your shot of HPV vaccination if you have not get it. Hope you have enjoyed the video. Like and share the video and please subscribe to my channel for more medical related stuff.